The study of electricity as it relates to living systems was further advanced in the late 1700s by the work of an Italian physician named Luigi Galvani. In a famous experiment using the corpse of a frog, Galvani was able to create a muscular contraction in the legs of the deceased amphibian by touching the exposed nerves with a variety of metallic leads. He concluded that the animal's tissue must possess an innate vital force, which he called animal electricity. Galvani's findings were later scrutinized by a colleague named Alessandro Volta. Volta correctly pointed out that in the case of the frog experiment, the stimulating energy that caused the legs to twitch did not originate from the animal, but from the electrified metal. Regardless of this distinction, Galvani continued to do pioneering work, providing an improved understanding of the inherently electrical nature of the nervous system. The Italian scientist's name is further immortalized in the term galvanized, which means to stimulate something or someone into action. Work like that of Galvani's is also likely to have inspired the imagination of a teenage novelist by the name of Mary Shelley. In her Gothic horror classic, Frankenstein, or the modern Prometheus, electricity is used to reanimate dead human tissue. The result is a tragic and tortured creature, bent on punishing the world for its life of isolation. While the monster is a work of fiction, some believe that scientists of that time could very likely have performed experiments like those in Shelley's book, focusing on electricity as the juice of life. While speculations like these make for good entertainment, legitimate healers dedicate themselves to finding ways of using electricity to help the living rather than the dead.
Basically, we use what's called electrical muscle stimulation or electrotherapy. And we're electrical beings. I mean, electricity is flowing through us, electric current is flowing through us. And electrical muscle stimulation is basically using very, very small amounts of electricity to cause muscle tissue to contract. So for example, someone might come in with a muscle spasm or a really, really tight muscle. Well, they can't stretch enough themselves to get that thing to relax. You can use electrical muscle stimulation to apply electrical current to that muscle so that it will contract and relax and basically reduce the spasm.
Electrotherapy treatments are also thought to release neurotransmitters called endorphins, which can stimulate pain relief.
You can also use electrical muscle stimulation to build up muscle that's atrophied or wasted. So for example, someone comes in and they've had a nerve injury that's caused part of their muscle to waste away and they've lost bulk in their muscle. You can use another certain type of electrical muscle stimulation to actually really contract and fire that muscle so that you get protein replication and you get the muscle to build back up.
Chronic back pain afflicts millions of people worldwide every year. Drugs, surgeries, and special exercise routines are available to combat this crippling condition. They don't always prove effective for everyone. However, electrical impulses can also be used to help individuals that suffer from this debilitating disorder, with a neurostimulation practice known as TENS.
People have often heard of TENS, which stands for transcutaneous electrical nerve stimulation, because anytime I'm stimulating a muscle, I'm stimulating a nerve, because the muscle doesn't move unless the nerve fires. So nerve and muscle go together.
Neurostimulation works by sending a carefully modulated electrical signal to the spinal cord or peripheral nerves. The signal is believed to scramble the pain impulses traveling the nervous system, replacing them with a gentle tingling sensation in a process known as paresthesia. There are external neurostimulation devices and internal units that are surgically implanted in the back. For many, they can provide a natural, non-addictive approach to managing pain. However, certain precautions must always be taken into account. Neurostimulation units should not be used by those who depend on pacemakers, as proper function can be interrupted. Deep heating microwave therapies, such as diathermy, absolutely cannot be used in conjunction with neurostimulation units without the risk of severe burns and nerve damage. In the grand scheme of man's history, the ability to harness electricity is a fairly recent development. But long before the work of men like Franklin, Galvani and Volta, other pioneering healers had discovered the potential of another form of energy, available by simply stepping outside into the light.
Can you just sanitize your whole room by simply having a little bit of UV light? And I think the jury's probably still out on that.
As the worldwide demand for electrical energy grows, mankind faces a constant struggle to generate enough power for everyone in need. Meanwhile, the greatest power plant in our solar system is burning fuel 24/7 right over our heads. The sun provides planet Earth with a nearly constant stream of radiant energy, better known as light. And like electricity, light has a history of medicinal use stretching back in time. Around the 11th century, a Persian physician and naturalist known as Avicenna came into prominence. Avicenna was a child prodigy. With such astounding intellectual gifts, he memorized the Quran by the age of 10, and at 16, he began studying and practicing medicine.
He kind of is attributed with starting the whole idea of using natural light therapeutically. He actually built a hut with a hole in the roof, and he would take patients with certain health ailments and put them on a table with the sun shining through the hole in the hut and exposing their body to it. And it kind of started a branch called heliotherapy or sun therapy. So the advantages of natural light have been around for thousands of years.
Naturopathic physicians like Benedict Lust heralded the health benefits of sunlight, especially in combination with fresh air and a natural diet. Like fruit and vegetables, sunlight is also a source of nutrients important to our daily well-being.
The most important thing we get from sunlight is vitamin D3. UVB light is what converts that compound in our skin from a cholesterol compound to vitamin D3. And vitamin D3 is really intricately entwined in our bone and calcium and phosphorus metabolism. There's a lot of research showing about the relationship between vitamin D3 and different types of cancers. So just like everything else that we have, vitamin D3 is important to many aspects of our overall being, and fortunately, we're able to make it by getting exposed to natural light.
While natural light can offer a wealth of potential benefits, if not used in moderation, those same rays can quickly turn deadly.
The biggest danger to overexposure to natural light is skin cancer, ultimately. What overexposure does, it actually damages DNA. I mean, that's what it does. It corrupts DNA. And so how skin cancer happens in a real general way is your cell types in your skin change. It actually causes them to, think of it as almost like they're mutating into a type of cell that's not supposed to be there. And then they can very easily metastasize or move around the body and cause lots of problems. But DNA damage is what a sunburn is.
We are all aware of the existence of light by virtue of the fact that we can see the objects around us. But we sometimes underestimate the power of light due to the lack of understanding about its nature. Light is part of the electromagnetic spectrum, which ranges from low-frequency radio waves to high-frequency gamma rays. Visible light, the light perceptible to our eyes, exists in the middle of the spectrum. Ultraviolet light exists beyond this visible spectrum, radiating at a higher frequency. According to some, it also exhibits healing properties that can be harnessed to treat a variety of ailments.
There is a lot of research and clinical information out about how certain types of blue light, ultraviolet light, does have an antibacterial effect.
This antibacterial effect has been shown to be especially effective in treating certain skin disorders, such as acne.
Ultraviolet light treats acne basically the same way that natural light corrupts our DNA. It kills the bacteria, most likely by corrupting the DNA of the bacteria. So in a lot of ways, it's the same thing that would happen to you and I, only it's a different part of the light spectrum that's doing that.
According to some, the usefulness of ultraviolet light isn't limited to topical applications. In a process called UV blood irradiation, or photoluminescence, blood is removed from the body and exposed to ultraviolet rays in an effort to promote healing. In the late 1920s, a Seattle doctor by the name of Emmett Knott first employed this technique to help a woman suffering from a severe infection. By the 1940s, UBI was being used to help patients in a number of American hospitals. It was regarded as a safe and effective means of ridding the blood of toxins and encouraging oxygenation. With the development of antibiotics, the technique began to fall from favour. But today, naturopathic doctors and those interested in holistic health are giving this FDA-approved procedure another look. Strong proponents for the use of ultraviolet light as a cleansing agent also maintain that bacteria are incapable of developing a resistance to UV rays.
The question becomes how much, to what degree does it have an effect? Can you just sanitize your whole room by simply having a little bit of UV light? And I think the jury's probably still out on that. But even in a topical application on human skin, there's a whole wealth of evidence to show that it does have an antibacterial effect.
Used properly, ultraviolet light appears to be yet another one of nature's weapons in the struggle against disease. But according to some, there's another stop on the electromagnetic spectrum that has just as much to offer.
There's like a little antenna waiting to receive certain kinds of light. And it's just like pouring gas in the gas tank.
All forms of radiant energy are represented as ranges along the electromagnetic spectrum. Ultraviolet, or UV light, buffers one end of the visible light spectrum and has been shown to possess valuable antibacterial properties. Moving in the opposite direction, wedged between visible light and microwaves, we have what is known as infrared light. Within this range, infrared light can be broken down into two categories: near infrared, which exists closer to the visible light spectrum, and far infrared, existing closer to the microwave region. We experience far infrared waves as heat. Special photographic techniques allow us to see this thermal radiation in everything from bonfires to our own skin. Near-infrared waves do not produce this thermal effect and thus can't be felt. But you can witness them in action every time you use a remote control. Doctors, however, have devised much more valuable uses for infrared energy than turning off and on the television.
Infrared light can be used to treat circulation problems, the kind of problems that are real common in people that have diabetes, because basically they get poor circulation, they get neuropathy, which is nerve damage, and so they can't feel their feet, and so they damage their feet and they don't know they're hurt. And there's just a big mound of evidence to show that you can use infrared light to help treat not only the circulation problem, but help the wound healing.
Advocates of this technique also tout its effectiveness in treating certain kinds of nerve dysfunction.
Infrared light is often used to help treat nerve dysfunction or nerve damage. I mean, I myself in my own practice have had numerous occasions where people have had numbness or tingling in fingers or digits due to an injury to a nerve, and we've used infrared light to basically bring back totally normal sensation and normal nerve function.
Watching the medicinal application of infrared light is admittedly unremarkable. The patient remains seated while the light therapy is applied with either a handheld probe or light pad. The probe is placed over the damaged or inflamed area for approximately 40 seconds, and a patient might receive 5 or 6 cycles per visit. But how does this simple exposure to red light supposedly do its healing work?
When we use infrared light or different types of light therapy, that light passes into the skin, is actually absorbed by the mitochondria. They have photoreceptors. There's like a little antenna waiting to receive certain kinds of light. And it's just like pouring gas in the gas tank. It absorbs that, turns it into ATP, which the cell then uses as fuel.
This improved cell function can contribute to improved circulation and decreased healing times. The treatment also provides a variety of additional benefits.
Number one, it decreases inflammation by directly inhibiting the formation of some inflammatory chemicals that are called prostaglandins.
Prostaglandins are hormone-like substances that play a part in a number of regulatory functions within the body, ranging from the dilation of blood vessels to modulating inflammation.
So you have a bunch of prostaglandins floating around, you're going to have pain, you're going to have discomfort. So the first thing it does is decrease prostaglandin formation, so it decreases inflammation.
Some patients also experience a reduction in pain.
This type of infrared therapy when it hits the nerve endings, they interpret that just the same as if someone were, brushing you on your hand. Like if you've smashed your thumb and you kind of grab your thumb and you kind of rub on it. Light therapy, when it hits those nerve endings, basically has the same effect. They interpret it as the same stimulation. And so consequently, it decreases pain.
Infrared healing technologies have also entered the wide world of sports. Professional athletes can comfort aching joints and muscles using infrared light with a device called a photonic stimulator. This technique may also find a home outside the locker room and beyond the stars, as NASA begins investigating the effectiveness of using infrared therapies on injured astronauts.
Houston to Genesis, press to ATO.
The future of light therapy is wide open, but when you treat someone that has a problem like a neuropathy or a joint that's been debilitating them, and you use this on them and they tell you, thank you, I was able to go on this cruise, or I was able to go dancing again, or I've got feeling in my hand back, that lets you know that how powerful light is.
When confronted with disease, it's always been our instinct to search the world around us in the hopes of identifying a cure. Whether it comes in the form of healing herbs, soothing waters, or primal energy, the world around us frequently has the means to provide the relief we seek. When considered this way, it's not difficult to view the power of light and electricity as just another pair of tools in the holistic medicine kit available to us every day as citizens of planet Earth.